about this is the director of the Vaccine Research Center at Cincinnati Children's Hospital, Dr. Robert Frank. Dr. Frank, thank you so much for being here with us. And what I want to talk to you about, since you're an expert at this, and honestly, I'm speaking a little bit as a person here as much as a reporter, because I have a young son. I have several friends who are expecting children. And I think that the questions across not just us, but for Americans everywhere are, what is going to be safe in those circumstances? We know that the trials have been playing out in healthy adults. We've gotten great news about it being safe for elderly people to take. But let's start with kids, especially young children. How are doctors going to figure out if this vaccine is safe for them? And what's the timeline for that, in your view?
So right now we're actually doing testing in adolescents down as far as 12 years of age. We paused to look at the initial safety for the 12 to 15-year-olds, and that looked really good. So we've restarted that as of 2 days ago, with the goal to enroll 600 children 16 to 17 years of age and 2,000 between 12 and 15 years of age. Once we get that data, then we would be looking at an age de-escalation, potentially even going down as young as infants.
So what's the difference for an infant or a young, let's call it a toddler? What's the difference between a toddler and, say, an adolescent? Because I know I was reading some of the research that shows there are many similarities between adolescents over the age of 12 and adults, but it can be really different for little kids. So what are you looking for, and how are those trials different?
So actually, most of the vaccines we use, even in young infants, are the same dose that we give for adults. So like for a flu vaccine, the dose we give to a 6-month-old is the same dose we give to an adult. So we'll be looking to see as if we need to decrease the dose, but it may be that we won't. The one thing as far as that in children under 2, there's some diseases where we need to use a special vaccine called a conjugate, because we're trying to get them to make an antibody against a sugar. But in these vaccines, it's an antibody against a protein, and our bodies can make antibodies against proteins as young as a few weeks of age. So we really may not even need to modify the vaccines much at all, regardless of how young it is. But that's one of the things we're going to be testing.
Well, that's incredibly encouraging to hear. Let's talk for a second about pregnant women specifically. And there's a couple concerns here, right? There's the safety of the mother, because we need to know if it's safe for them, considering the way their body is affected by pregnancy, and also if it's safe for a baby who is not yet born. And I know that there are some vaccines that we don't give to pregnant mothers for that reason. So what kind of concerns do you have about pregnant women?
So for pregnant women, the vaccines that we would stay away from are live virus vaccines, but that right now a woman is recommended to get a flu vaccine with every pregnancy, every year, and a pertussis vaccine with every pregnancy. So there's a good track record of using vaccines in pregnant women. And while the risk of COVID doesn't seem to be extremely higher in pregnant women, there are some data that suggests it is a bit higher, and that's why we do think it's important to study pregnant women and look about vaccinating in that group. As you mentioned, is that one of the things that we looked at is not only the women, but the babies. But because this is not a live virus or a live bacteria kind of a vaccine, the risks to the fetus really shouldn't be that great. But again, it's the things that we want to test.
All right. Well, that again, great and positive, encouraging news. It is a nice change of pace, I think, for all of us after covering this pandemic for so many months, and of course, people having such a terrible time with this disease. Dr. Robert Frank, thank you very much, and our thanks to you and your teams who are doing all of this critically important research. So thank you very much.
Thank you.